Namaskar, I am Dr. Manish Sachdev, a practicing diabetologist at Thane, Mumbai. I am in practice for last 33 years. And all these years, I have been seeing diabetes and hypertension patients day in and day out. And we all know other complications of diabetes and blood pressure. But the one that patient is not easily able to take consultation for is erectile dysfunction. Up to 75% patients of blood pressure and diabetes are having erectile dysfunction. And we must know that erectile function is defined as inability to maintain the erection so as to perform a successful sexual act where both the partners are satisfied. And we must know the causes of erectile dysfunction. We all know that to have good sex, good good erectile function, we must have sound mind, sound arteries and sound nerves. So when any of this component is harmed, we are likely to encounter the erectile dysfunction. So what happens in blood pressure? Due to forceful flow, the arteries get damaged. When arteries get damaged, they can't get filled up with the blood, which is the major component of erectile function. So to have good erection, we must have good arteries. So when you think of sex or sexual stimulus is there, nitric oxide is released and the arteries dilate and the blood is filled up in those venules, and that is maintained to have good erection. Simultaneously, the nerve sensations have to be intact so that stimuli reaches the nerve vessels to open up by releasing the nitric oxide and proper nerve stimulation. And the most important, if the patient is depressed or anxious, for example, performance anxiety or chronic depression associated with this chronic diseases, blood pressure and diabetes, patient is bound to have erectile dysfunction. We have many treatment options available depending on the cause of the erectile dysfunction. For example, injectables and implants. Injectable, we have got prostaglandin substances which are injected directly in the cavernosa, the tissue of the penis, which immediately leads to vasodilatation or opening of the arteries, and the blood is filled up in that venule. Implants are prosthetic devices which maintain the erection after being implanted by a proper surgeon. Also, we have vacuum constriction devices wherein you put the device around the penis base, and by creating vacuum, you get instant erection, and then a ring is placed on the penile base where the erection is maintained. But all these things are little advanced options. We have oral molecules like PDE5 inhibitors, which are called tadalafil, vardenafil, and sildenafil. So these medicines are known for last 15 years to be in the market, and they have given good results in erectile dysfunction, but they have their own side effects. For example, they cannot be given with some of the heart medicines. Also, they cause blurring of the vision, they cause headaches, and these side effects can deter the patients from using it. So we have safer options in the market like Prilox, which is a safe and natural alternative to allopathic side effect causing medications. So let me explain to you what is Prilox. It is a combination of L-arginine and pycnogenol that boosts the overall sexual wellness. L-arginine is known to increase the nitric oxide in the arteries of the penis, thereby leading to better erection. This is imported from Horfeg Research, Switzerland, and it is available in more than 80 countries. This beautiful formula has been proven to improve erectile function in the person, and his overall quality of life improves. Also, we have a lot of scientific data to back our claims. Almost 135 clinical references and 70 clinical trials conducted in more than 20,000 patients, and this is a good data. Prilox increases the nitric oxide, which is related to vasodilatation or the arterial dilatation in the penis, and thereby it leads to a good erectile function and gives good satisfaction to the patient. Also, we must know that it is available in our country and it is to be given to the patients above 18 years of age, and middle-aged and older age patients are also safe to use. Dose is according to your physician, and this is a product worth trying. Thank you.